More than 2 million Americans and 23 million people worldwide suffer from rheumatoid arthritis, an autoimmune disease that causes inflammation and joint damage throughout the body. The disease can strike at any age, but 3/4 of patients are women. Rheumatoid arthritis can cause chronic swelling and pain, resulting in disability and deformity for patients, making it difficult to get out of bed, to get dressed, and to hold down a regular job. While the underlying cause remains unknown, and there's no known cure, there are medications that can alleviate the symptoms and reduce the progression of the disease. The problem is that these drugs don't work for everyone. We tested a new oral drug called baricitinib on over 500 patients with hard-to-treat disease. This medication disrupts the activity of an enzyme, Janus-associated kinase, inside human inflammatory cells. By reducing the activity of this enzyme, we can reduce the products of these cells and thus reduce inflammation. In our randomized placebo-controlled trial, we found that baricitinib significantly improved symptoms in over 50% of the subjects by 12 weeks. This improvement was independent of how long these patients had suffered from their disease or their prior treatment history. This is the first drug to demonstrate meaningful clinical benefit in patients who have failed virtually every other commercial drug for rheumatoid arthritis. And it will hopefully improve the quality of life for patients suffering with this disease.
The United States is in the midst of an addiction crisis, killing over 30,000 citizens each year by overdose alone. Many of these victims became hooked on painkillers because they were not warned about the risks of addiction. The standard treatment involves transferring the patient to another opioid, such as methadone or Suboxone. We just reported a completely new approach using naltrexone, a medication that blocks opioid receptors and prevents heroin and other opioids from getting to the receptor. It doesn't produce dependence or drowsiness, so patients can function normally in school or work, and it can be stopped without a withdrawal syndrome. Each dose lasts 30 to 40 days, and most importantly, it prevents relapse to opioids and overdose. In our study of over 300 patients treated for 6 months, there were 7 overdoses in the comparison group and 0 in the patients randomized to this new medication. This is a completely new approach to treating opioid addiction, and it has potential to save many lives.
So we started with a very simple question. If you're at high genetic risk for heart attack, can you overcome that risk by adhering to a healthy lifestyle? We studied this question in over 50,000 participants from several research studies. All these participants were healthy at baseline and then followed over time for risk of heart attack. From the baseline information, we determined an individual's genetic risk by looking at over 50 genes and grouped the 50,000 participants into high genetic risk, intermediate genetic risk, or low genetic risk. We also characterized their lifestyle habits at the baseline and grouped them into an unfavorable lifestyle, intermediate, and favorable lifestyle based on just 4 factors: whether you smoked or not, whether you're obese or not, whether you had a prudent diet, or whether you had regular physical activity. And we looked at the relationship between the genetics and the lifestyle in terms of risk of heart attack. And what we found was that if you're at high genetic risk and unfavorable in terms of your lifestyle, you had about an 11% risk of heart attack over the subsequent 10 years. But if you're high genetic risk and had a favorable lifestyle, your risk of heart attack was only 5% over the 10-year period. This means that a favorable lifestyle can cut the risk of heart attack by more than half among those at high genetic risk. The take-home message from the study is that DNA is not destiny, at least with regards to heart attack. That you actually have control over your risk by being ideal in terms of lifestyle factors. And I think this is a very good public health message that we all can actually reduce our risk by doing these relatively straightforward things like regular physical activity and eating a healthier diet.
Acute respiratory distress syndrome, or ARDS, is a condition in which the lungs become leaky and fill up with fluid. As a result, oxygen cannot be absorbed into the body, and patients usually don't survive. A special mask had been developed to deliver oxygen at higher pressures and perhaps prevent patients from needing a ventilator. Unfortunately, this mask can be quite uncomfortable and can leak substantially, especially at higher pressures. In fact, about half of the patients with ARDS who use the mask require the ventilator anyway. We wondered if a different mask, known as the helmet, might improve patient tolerability. The helmet is a transparent hood that covers the entire head of the patient. The seal is at the neck so that it can tolerate higher pressures without substantial leak. So we conducted a clinical trial where we compared standard face masks to the helmet in order to prevent patients with ARDS needing the ventilator. We found that helmet ventilation reduced the chances of needing a ventilator from 60% to 20%. If we treat 5 patients with ARDS with a helmet, we can prevent 1 death. These results were quite surprising, and we hope can dramatically change how we care for patients with ARDS.
Both genetic risk factors and the environment play a critical role in the development of asthma and allergies. Epidemiology studies have shown that children raised on farms are protected from these diseases. The central question driving our study was, how does the farming environment protect against childhood asthma and allergies? To investigate this question, we studied 2 U.S. farming populations that share a common ancestry and similar genetic backgrounds, the Amish of Indiana and the Hutterites of South Dakota. Strikingly, the prevalence of asthma is 4 times higher in the Hutterite children than the Amish children. Our study investigated whether Amish children live in an environment that reduces the risk of allergic sensitization through the modulation of the immune response. While many lifestyle factors that influence asthma risks are similar between the 2 groups, they differ in regards to their farming methods. The Amish community uses traditional farming methods, and the children are all involved in farming. In contrast, the Hutterites use modern farming methods, and only the men work in the fields and the barns, and the children have limited exposure to the farm environment. We found that compared to the Hutterite children, Amish children have alterations in innate immune cells, such as neutrophils and monocytes, and upregulation of innate immune gene expression pathways. Strikingly, dust from Amish homes, but not from Hutterite homes, was sufficient to protect mice from allergic asthma through signaling the innate immune cells. The results of our studies in humans and mice indicate that the Amish environment provides protection against asthma by engaging and shaping the innate immune response.
So the clinical background of this research is in the context of metastatic prostate cancer or advanced prostate cancer, where androgen deprivation therapy is the upfront standard therapy, and it's been so for over 70 years. So when patients are treated with androgen deprivation therapy, their tumors will initially respond, and eventually, after several months to several years, they become resistant. And when these tumors become resistant, they do so by making their own androgens. And a few years ago, we identified the first example of a genetic mechanism which allows tumors to make their own androgens more rapidly. The current research question was to ask whether when patients inherit this particular genetic feature, they develop resistant disease more rapidly. And the answer across 3 patient cohorts is a resounding yes. So this allows us to identify patients through genetic means who have disease that's worse and perhaps think about treating them differently.
Every year, 700,000 Americans suffer from a heart attack, and approximately 15% will die within the following 30 days, what we call early mortality. But early mortality rates vary significantly from hospital to hospital. Prior to our study, almost nothing was known about how early differences in hospital mortality affect long-term patient survival after heart attack. We asked, do heart attack patients treated at the highest performing hospitals with the lowest upfront mortality rates actually have longer life expectancies? To do this, we developed new techniques for measuring life expectancy and used data from the largest study of heart attack patients ever conducted. We found that patients treated at the highest performing hospitals lived on average 9 to 14 months longer than patients treated at the lowest performing hospitals, which was largely attributable to differences in survival in the first 30 days. Our findings show that early, high-quality care at the highest performing hospitals saves lives, both in the short and long term.
Over 1 million babies are delivered by cesarean in the US every year. An estimated 1 in 8 moms will develop an infection at the surgical site, causing great suffering and in some cases even death. Proper skin cleansing has the potential to reduce surgical site infection, yet the best antiseptic to use was unknown. We randomized over 1,100 racially diverse pregnant women undergoing cesarean section to either chlorhexidine alcohol or iodine alcohol. Surgical site infection was diagnosed in 42 patients cleansed of iodine alcohol as compared to only 23 in the chlorhexidine alcohol group. This translates to a nearly 2-fold decrease in surgical site infection. This is the largest trial to date on preoperative skin cleansing and has already changed clinical practice, with many hospitals using chlorhexidine alcohol for all surgeries. But I am most excited about how this simple intervention is improving the lives of so many new moms and their infants.
Pemphigus is a potentially deadly autoimmune blistering disease that occurs when the immune system mistakenly attacks a protein in the skin known as desmoglein. Current treatments indiscriminately suppress the immune system, which risks deadly infections. So ideally, we would develop precision therapies that eliminate only the disease-causing autoimmune cells while preserving the good immune cells that protect you from infection.
Using desmoglein, the target of the immune attack in pemphigus, as a decoy, we genetically engineered chimeric autoantibody receptor, or AA CAR T cells. Desmoglein AA CAR T cells eliminated disease in a mouse model of pemphigus without any detectable collateral damage to other tissues.
So our past success in inducing long-term clinical remissions in patients with cancer really suggests that this new CAR technology has the potential to offer both safe and durable therapies for patients with autoimmunity, and we look forward to developing this new technology into human clinical trials.
There's a center within the brain that, if it's destroyed or interfered with, can reduce the tremor in patients with essential tremor. A patient lies in the MRI, wears a head frame, and that aligns the device that takes 1,000 beams of ultrasound energy and targets a spot about the size of a pea, and in real time one can see the tremor of the patient be reduced, and we can examine the patient to make sure that there are no off-target effects on brain that we don't want to damage. On average, they had greater than 50% reduction in tremor. And we're talking about 80, maybe 90% reduction of the size of the tremor, a dramatic improvement in their quality of life, and reduction in the disability caused by the tremor, usually of their dominant hand.